So, good evening, all the viewers of Homeo Health Channel by Dr. Varsha. And आज काफी टाइम के बाद मैं आई हूँ ड्यू टू सम ऑफ द रीजंस हम लास्ट वीक नहीं कर पाए थे ये लाइव जो मुझे लास्ट 1.5 ईयर से करना था। एंड आज मुझे वो मौका मिला है बहुत टाइम के बाद कि मैं ऐसे व्यक्ति को, ऐसे डॉक्टर को आज इंटरव्यू करने जा रही हूँ जो मेरे आइडल है, जिनसे मैं बहुत सारे डिस्कशंस करती हूँ, मेरे केसेस में उनसे मैं राय लेती हूँ बहुत बार। सो ही इज द वन पर्सन जिनको कभी भी कॉल करो ही नेवर डिनाइज कि मैं इस केस में तुझे नहीं बताऊंगा। एंड फॉर दैट रीजन आई वांटेड हिम टू कम टू माय चैनल एंड शेयर सम व्यूज अबाउट हिज एक्सपीरियंस विद डिफरेंट टाइप्स ऑफ केसेस। बट जो उनका जो यूएसबी है वो है पैथोलॉजिकल केसेस। नाउ व्हाई पैथोलॉजिकल केसेस, हम उसके बारे में क्यों बात करना चाहते हैं। तो जितने भी होम्योपैथ्स होते हैं, इजी केसेस लेना हमारे लिए बहुत इजी हो जाता है, क्योंकि जैसे जैसे आप प्रैक्टिस में उतरते हैं तो हमें नॉर्मल केसेस बहुत इजी लगने लग जाते हैं। लेकिन जब भी कोई डिफिकल्ट पैथोलॉजिकल केसेस हमारे पास आते हैं तो हम डर जाते हैं। हम डर जाते हैं कि हम इसमें करें क्या, हम किस तरीके से इसको डील करें, किस तरीके से पेशेंट को कन्विंस करें, बात करें, उनका प्रोग्नोसिस क्या रहेगा, क्या हमें कन्वेंशनल मेथड्स के साथ इस मेडिसिन को ऐड करना चाहिए, क्या हमें उसको कुछ और तरीके से हैंडल करना चाहिए, क्या प्रोस्पेक्टिव होना चाहिए एक पैथोलॉजिकल केसेस को लेने में। इन सारी बातों के आंसर्स आज हमारे यूट्यूब चैनल पे हम डॉक्टर हार्दिक कमार से जानेंगे। तो उनके बारे में बताऊं तो ये वो इंसान है जो कभी भी खुल के बाहर नहीं आते हैं, जहां तक मैं इनको जानती हूँ। इज नॉट दैट सोशल मीडिया पर्सन, बट ही इज वन ऑफ द वेरी ग्राउंडेड एंड वेरी वेरी नॉलेजेबल पर्सन, जिनको इतना ज्यादा पैथोलॉजिकल केसेस में इंटरेस्ट है कि उनसे सीखना एक हमारे लिए आज बहुत बड़ा एक अपॉर्चुनिटी होगा कि शायद हमारे पैथोलॉजिकल केसेस में हम आज से ज्यादा अच्छा रिजल्ट दे पाए and we become more confident about it. So, talking about Dr. Hardik Khamar, he is an MD homeopath practicing since more than 22 years in Ahmedabad, having two branches of his clinic named Homeopathic Care Clinic in Maninagar and Vastrapur in Ahmedabad. And he is also a visiting faculty at Sardar Patel University. He is a panel doctor at National Institute of Design Ahmedabad because he has done his certificate course in design thinking and innovations from Delhi. And he has also done his SEMT, that is a course in mistletoe therapy from Germany, which is something different. We'll talk at the end of the session what it is. And he's also a co-founder of Prayas Homeopathy and Cancer Research Foundations, जिसके बारे में मैक्सिमम लोगों को पता होगा। नहीं पता है तो this is the foundation who works with the cancer patients with the help of homeopathy and helps them a lot. He is dealing daily with the difficult cases like neuropsychiatric cases, even the PCOD, lifestyle disorders, thyroid, diabetes, hypertensions, and many other such cases in his daily practice. He has more than 40 to 50 patients in a daily basis of OPD, and which is a wonderful number I could actually sense about. He has also presented multiple papers and different level of stages. For example, he has presented in Liga, which has happened in 2022 in September, Istanbul, Turkey, in which his topic was related to remedy relationship. And if you want to see that video related to remedy relationship, हमारी अहमदाबाद यूनिट में उन्होंने इसके बारे में बहुत अच्छे से बात की है. I've already seen that video. It's a wonderful video to correlate the remedy relations in a different थिंकिंग वे. सिर्फ जो पीछे बुक में दिया है वैसे नहीं, कुछ नया प्रोस्पेक्ट है उनके टॉक में, तो आप उसको भी देख सकते हैं. He has also done paper presentation in Liga LMHI, which was for the postgraduate homeopathic educations in 2021. He has also presented his paper in Ukraine Homeopathic Congress about the emotional mental cause as a catalyst in cancer development. And many other things, like he has also presented in All India Homeopathic Congress exploring the practical utility of alphenotestase मटरा मेडिका इन कंटेम्प्रेरी होम्योपैथिक मेडिसिन, जो मैंने लाइव उनको सुना है. ही हैज वर्कड अ लॉट फॉर 7 years on that topic, and he has also presented with understanding the long COVID its management and future perspective about it in 2024 February. So many others are there. अगर मैं उसके बारे में बात करूंगी तो बहुत टाइम चला जाएगा, हम अपने टॉपिक पे नहीं आ पाएंगे. And one more very interesting thing, he is the person, इतना busy schedule में से he always take a chance to enjoy his hobby. And one of the very very interesting hobby he has is paragliding. 250 बार से ज़्यादा paragliding कर चुके हैं. So this is very interesting for him क्योंकि as a busy schedule doctor अपने hobbies को enjoy करना is like, we'll talk some other day about it also, कि how he balances his hobby and daily practice. So I welcome you, sir, on my channel.
Thanks, Dr. Varsha. Good evening for such a nice introduction, which I haven't even thought of. Thank you for that.
Thank you so much, sir. I am the person who is literally waiting to interview you since more than a year, but it couldn't work out anyway. I can understand you have a very big busy schedule, but yes, today I got the chance to interview and I didn't want to miss at all. Now, coming to the topic, sir, how was your journey as a homeopathic? First, I want to know that.
So I would say that some journeys require some accidents.
Right.
I never thought of becoming a homeopath. Rather, never even thought of becoming a doctor. I wanted to go and feel something which was called as dairy technology.
Okay.
I gave an exam for that in 12th. Otherwise, I was a very confused person in 12th, 11th. क्या करना है नहीं पता था, frankly. No
Okay.
clarity. And a small paper ad took me to homeopathy. And I just got and I was given admission. But then that day one of my college days, somehow I could realize that, this is for me.
Okay.
It happened by fluke, but then it became life for me. So that one day of that, my organon teacher certain words and talked about Hahnemann and aphorism 1 and what can be homeopathy. It's a holistic therapy, and I don't even remember such words. But then at the end of the day, I was very clear that whatever decision destiny has given, it is the right decision.
And we are very lucky to have you as a homeopath now. Okay. One more thing, sir. What was your turning point to deal with such a difficult cases in your practice? Because this needs a lot of struggle, a lot of knowledge, as well as like people are afraid of treating a pathological cases in their practice, because dealing with the simple cases becomes very easy, chronic cases becomes very easy, but in pathological cases sometimes there is an acute exacerbations, then sometimes there is a difficulty in practicing. So what was your turning point to only focus in such type of difficult cases?
It's a very interesting question. I cannot answer. There is one turning point, but there are various turning points.
Okay.
It's like when you start your journey as a student in your first year. First of all, you do not know what is pathology. There is no
Right.
question of how to treat them clinically. You have no vision. But then we are being taught like that the physician's high and only mission is to restore the sick to health. अभी ये sickness क्या क्या आने वाली है, वो तो that 5 years of a learning will only tell. So we kept on doing the basic things, learn material medical, learn organon, learn repertory, learn medicines whatever way we can. But then certain teachers and few of friends, okay, they started doing work on this, and that actually shifted. Like I would definitely like to put Dr. Munjal, one of my very good close mentor, I would say. He took me to Dr. Barwalia in Mumbai,
Okay.
and then foundation, holistic foundation, where I learned treating neuropsychiatric disorders like ADHD, like autism. So
Right.
total, thankful to Dr. Munjal, then he took me to Dr. Barwalia. So this was
Okay.
a connecting dot again. So
Okay.
neuropsychiatric disorders, they are pathological cases. They are deep
Right.
pathologies. So that was one connect dot to be connected. And then there is a very close friend, Dr. Shruti. We have worked together throughout. But then
Right.
she was working with cases of cancer. I would bluff her out with what rubbish things you are doing.
Yes.
I to dare do such things. And incidentally, one day she met Dr. Sarkar in Kolkata, and then he took care. He's a person who is doing this kind of things. And her one line actually triggered something in my life. And I had a chance to meet Dr. Sarkar and work closely with Dr. Sarkar. So I would say that heart khule, and taking up challenges in pathological cases, thankful, everything goes, credit goes to Dr. Sarkar.
Right.
Various approaches I could learn. So this was the turning point, ultimate turning point, which I would say. And start kiya the practice. Third or fourth day, I got a case of a huge parotid tumor, almost like size of 10 to 12 centimeter. A
Right.
patient called me, I went and visited her at home, but then 6 or 7 days the patient passes away.
Oh.
The first case of cancer ever I got opportunity passed away. scientific pathway, but that caused a fear in me. And I made a decision why to treat such things which are incurable, treat things which are curable. But
Right.
then after meeting Dr. Sarkar, there is total shift in taking up such cases. Not restricted to cancer, but multiple pathologies, like systemic
Right.
pathologies. So then there are many cases after that.
Right. So very interesting, sir. You got chance with so senior doctors and very experienced doctors to deal with, and your failure also. See, talking about failures is more important than the success rate, because everyone talks about the success, but it
Exactly.
needs a lot of daring to talk about failures also. Okay, ऐसा हुआ था कभी ना कभी. Sir, coming to our topic, because we have a very
I would also
strong.
correct you, ऐसा अभी भी हो रहा है.
Yes.
Okay, so because ultimately pathological cases. Yes.
Okay. Failures are the part of life, right? Part of a practice. Okay. Sir, what are the actual pathological cases in your practice? Can you give a brief about it? Okay? Which cases we can tell now this is the pathological cases and this are might be difficult to treat.
So for a brief, like in a nutshell, we can tell like every disease is a pathology.
Right.
We have to define that this pathology is functional pathology or a structural pathology.
Right.
Because once we enter second year, there is something like inflammation which we are taught on our day one.
Hmm.
That inflammation itself is a pathology.
Right.
So mostly all pathologies are reversible because body has a mechanism called inflammation. There are sequelae of inflammation. Everything starts from an inflammation. And
Right.
inflammation, if doesn't heal on itself or by medicines, there are various sequelae of inflammation, and that's how we learn whether it's an ulcer or a necrosis or a degeneration
Right.
or neoplasm. So when the function enters to the sequelae of this kind of structural pathological changes, I personally call them as pathological cases. And the range is from now system to system.
Right.
For example, the easiest case I would say like respiratory allergies. But
Right.
the same allergy when turns into an autoimmunity, it's a pathological case.
Right. Right.
Turns into an asthma, it's a pathological case. The reversible stages are like allergic bronchitis or tracheitis, which are reversible. But
Right.
asthma, yes, is a structure or interstitial lung disease
Right.
or bronchopneumonia or bronchiolitis.
Right.
So this, in a brief, I'm telling. So every system has something from a very basic inflammation to neoplasm.
Right, right. Definitely, definitely. That's very true and very precise to explain about pathological cases. Now, sir, we usually deal with like every homeopath has an habit of taking a long history and dealing with the every cases they come in encountered with. How this methodology is different in pathological cases rather than a simple cases we encounter in daily practice. Is there any different approach you take while encountering the pathological cases?
So case taking won't be different,
Right.
but approach will be definitely
Okay.
case-based approach. So there's a famous quote by Dr. Ken, the well-taken case is half cured.
Right.
So for me, acute case or chronic case or pathological, structural, non-structural, whatever, case complete होना चाहिए. In
Right.
case, obviously, will be according to the guidelines of Dr. Hahnemann has given, like
Right.
from head to foot. Okay,
Right.
some cases may take 5 minutes, some cases may go to 5 years also. We do not know.
Right.
But till the homeopath feels that okay, I'm satisfied with the case. now इसके बाद में कुछ आने वाला नहीं.
Hmm.
And that is very subjective. It can be different from you. It can be different with anyone else.
Exactly. Definitely.
Patient will patient speaking also dependent on what has been asked by the doctor taking interview at that time. So case taking ranges from patient to patient. Now,
Right.
once we receive the case, we get the case. So from the symptoms what we are having, or from the pathologies or the structural damages what patient is having, and whether there is a characteristic is absent, ODP, multiple things which will decide the approach. Approach can be like no end to it. So
Right.
people like question that आप classical homeopathy करते हो कि non-classical? Like, you see, it's like music. So
Right.
classical music is like which follows the rules.
Right.
सारेगामा पदनिसा है,
Right.
क्लासिकल है, वो नहीं है तो क्लासिकल नहीं है.
Right.
तो रस द सेवन प्रिंसिपल्स ऑफ होम्योपैथी है, लॉ ऑफ सिंप्लेक्स है, लॉ ऑफ सिमिलिया है, तो ये क्लासिकल हुआ. So
Right.
everybody in there sits a classical homeopathy in everyone of us.
Yes, definitely.
Everyone is a classical homeopathy. Now, a classical singer versus a musical composer.
Right.
Like let us say example of A.R. Rahman or Pritam. Compose
Mm-hmm.
music. They know the classical, the whole beats of the music. But उसको tweak करके उसको कौन से सुर का कैसे इस्तेमाल करके क्या म्यूजिक का कंटेंट करते हैं. So
Right,
these are the same principles, but the prescription point or song के form में different होते हैं. Same are the approaches.
right,
All approaches are classical. Now whether you are taking a therapeutic approach, you are taking a repertorial approach, उसमें भी आप फाटक को ले रहे हैं कि बोबर को ले रहे हैं, केंट को ले रहे हैं या किसी और को ले रहे हैं.
right.
So it is like composition of that music using the same sur. I
Right.
hope this analogy works to
It's
understand.
very true, very true. What you are explaining is very true. True कि हर एक होम्योपैथ के अंदर एक क्लासिकल फैक्टर रहता ही है. बट आप किस पैटर्न में जाते हैं वो केस टू केस डिपेंड कर सकता है. एंड दैट इज द कॉम्पोजिशन वी नीड इन एवरी केसेस. सो
Exactly.
अप्रोच शुड बी लाइक फ्लेक्सिबल विद केसेस. एंड
Yes.
इट्स
Yes.
वेरी प्रैक्टिकल, राइट. बिकॉज अभी क्या है, आई ऑलवेज एनकाउंटर कि एक पर्टिकुलर मेथड को जब आप पकड़ के बैठते हैं ना, तो इट बिकम्स डिफिकल्ट टू ट्रीट ईच टाइप ऑफ केसेस. But when you have that flexibility with every cases, so you can manage multiple more cases in your practice. That's true, that's true. Okay, sir, according to your experience, what you have dealt with, I think more than 10 years you are doing with pathological cases in a
More
daily
than
basis.
that, no, yes,
More
almost
than
yes.
that you are doing.
Yes.
What is the efficacy of homeopathy in it? And is there any evidence-based study or something has been done so that we can have that prospect, na, ki, yes, we can do it. So, as per your experience.
The answer can be yes and no.
Okay,
So let me give the answer of no first.
okay,
So in homeopathy practice, see we have lot of cases ranging from common cold to cancer daily. You also
right.
must be having, I also have, and everyone
Yes,
has it.
yes, definitely.
The answer is no, where because we do not document that cases each and every time because we are not academics, full-time academicians, we are part-time academicians, but we are clinicians.
Right,
Every day, day-to-day management of the cases is doesn't not always possible.
exactly.
It doesn't go for me every time. I try to
Right.
document each and every cases, but then
Right,
what can be done is can be kind of a case series. For example,
right,
if we're taking 10 cases of say glomerulonephritis or
right,
say chronic renal failure,
right.
and then you study these 10 cases at one reference point and see the approaches. Then we can have something data which can be managed. It is the easiest form of management of data every clinician can do. Like we and Dr. Munjal keep discussing about it. Case series karo, because that is the main baseline of any research.
Right,
Where the answer is yes, indirectly every one of us is doing that.
okay.
Everyone has a record of, say, I have 20 cases of asthma, or I have some 20 cases of cancer, or 10 cases of allergic rhinitis. Now, if you look them retrospectively, like, chalo, let me open my asthma cases and see which approach I took. So, फिर बहुत data निकल के आता है.
Yes,
ये
that's
हम- This we do not do on regular basis.
exactly.
Look back, every case has its own individual way of treatment, उसका पोसोलॉजी गिनो या अपने रेपोर्टरल अप्रोच, आपका थिंकिंग प्रोसेस, वो हम उसको डॉक्यूमेंट नहीं करते. How about
Exactly.
documenting that thing every time? Like when I'm making a decision of prescribing this, एक ब्रैकेट में लिख दो the reason for prescribing.
Exactly. This happens with me also. मेरे को फिर याद नहीं आता है कि मैंने ये क्यों दी थी उस समय.
Then if you look back 20 cases, आपका एक रिसर्च बन के खड़ा हो जाता है, लेकिन आपने तब डॉक्यूमेंट नहीं किया.
Exactly. This is
अब
very
अब
true.
अब वापस देखते हैं तो उसको कलेक्ट करना बहुत मुश्किल हो जाता है.
Exactly.
So this answer is in yes and no. So yes, there are many cases. अभी result ratio पूछने जाओ तो it is very tough question to answer unless they are into some study.
Right.
So let me tell you, I did a case series of nearly 20 cases. So, but then again, 20 cases were chosen on out of some 140 odd cases of cancer which I treated. So case series might took only those cases which were varied from lung cancer to breast cancer to prostate cancer. But अभी उसका मैग्नीट्यूड हर पेशेंट का अलग अलग, तो एक
Exactly.
फ्रेम में लाना मुश्किल है.
Right.
But then I would say very loosely when I started treating cancer cases, तब मुझे 5% पेशेंट में रिजल्ट मिलता था. अभी I would say 50 to 20%.
That's a
I
good.
would say a huge number. Okay, I don't say that small number because multiple other parameters also. Now these are cancer cases. If we shift our gear to cases like rheumatoid arthritis, again the ratio is now 30-40%, where we could have make the patient like steroid free or painkiller free.
Yes.
But then every disease like RA or asthma or cancer, उसका एक स्टैंडर्ड पैटर्न हमको कंपेयर करना पड़ेगा स्टडी में रखने से पहले. जैसे रूमेटॉइड आर्थराइटिस में लाइक देयर आर 5 साइंस वी सी,
राइट,
बाइलेटरल सिमेट्री है, बॉन्डिंग स्टिफनेस एंड ऑल. आर दिस पैरामीटर्स डिसअपियरिंग आफ्टर योर मेडिसिन्स और नॉट?
That's true. That's true.
You easily find on Google or any medicine के textbook में. So we as a learners and practitioners of homeopathy, we integrate this small thing and we record our follow-up in the same pattern. Every time we record the follow-up in the same pattern. Okay, 5 deciding factors है RA के. तो वो patient में बढ़े हैं, घटे हैं, increase, same status, तो whatever.
Right.
And then if we measure ourselves, then things can be different. I always feel like something like SMR, specific measurable results.
Right.
Every case, whatever you are treating in your clinic, no, this I don't do this each and every time in my cases, but in certain cases, yes. So like SMRs can be defined by yourself also. You decide your follow-up criteria. Case में मैं क्या देखूंगा, क्या देखूंगा.
Exactly.
Specific measurable results. इसको 6 महीने बाद कहाँ पे होना चाहिए, क्या है, क्या नहीं. Record cases in that. See, if you go to any ICU, medical ICU या any medical hospital, एक टेम्परेचर चार्ट होता है, एक पल्स का चार्ट होता है. These are very simple thing, and whole evaluation is based on that. So I'm talking about this kind of simple SMRs.
Yeah, definitely.
Not big jargons I'm talking about.
Right.
We try to put that into a daily case sheets, and I think that वो सोया हुआ अंदर का होम्योपैथ वो जागेगा और भरोसा लगेगा अपने आप पे. Okay, I can do this. Start with small things, not with large things.
Right. Very true. Very practical approach. तभी हम explain भी कर पाएंगे what we have did with our medicines, right? How it worked. Okay, that's very true, sir. Sir, can you explain how your patients have, at what level they have an expectation with homeopathy, and actually what is the reality behind it? कि पेशेंट्स को तो बहुत एक्सपेक्टेशन होती है ना, कभी कभी हमारे पास आते हैं एंड से कल से एलोपैथिक बंद, ऐसा कोई कन्वेंशनल मेडिसिन बंद. ऐसा नहीं होता है रियल लाइफ में. तो पेशेंट की एक्सपेक्टेशन पे आप किस तरीके से वर्कआउट करते हैं, और एक्चुअल रियलिटी बेस क्या है आपके इतने साल के एक्सपीरियंस में, कि क्या कितने हद तक हम पेशेंट को रिजल्ट्स दे सकते हैं?
So there are multiple answers to it. First answer will be there are clusters of questions will be and clusters of expectations will be coming from patients. So let us bracket some 3 or 4 top 3 clusters of patients. First clusters, obviously, they expect a miracle cure or whatever pathology they are curing. This is one cluster. And as a homeopath, you know, when a patient is coming to you, say कोई XYZ CA लेके आ गया है patient, so first of all homeopath feels pride. It is an overwhelming thought process. Okay, मेरे पास ये patient है, तो particularly new or middle experience homeopath. Patient भी बहुत expectation के साथ है कि okay, I heard your name, I will come to you and you treat me. So दोनों की तरफ से there is an overwhelming thing, and this overwhelming expressions sometimes sway away. I also promise you, and you also buy my promise as a patient.
Right.
This can be counterproductive. Okay? So there are no miracle cures. First of all, there cannot be miracle cure.
Right.
Reassurance is always important. First, let me take your case. Let me go through the pathology. क्या है? And उस हिसाब से आंसर देना पड़ता है. And it should be a very smart answer. And right answer. Smart answer क्या है? जो answer है वो right answer देना. Okay, this is something what. If you remember Hahnemann का एक aphorism में लिखता है, forgetting the name of the aphorism, number of the aphorism, but what is to be cured in the disease? Aphorism 3, I guess.
Right.
Is to be cured in the disease. Every time in every patient with a common cold or anything, what is to be cured in the disease? My expectations can be anything as a patient, but as a homeopath, as a physician, what is to be cured in the disease? वो तो हमको define करना पड़ेगा. It will only come after case study. So my simple answer to this is let me take your case.
Right.
ठीक है, तो ये एक क्लस्टर हुआ, एंड आई थिंक दिस क्लस्टर कम्स विद एवरी, and it's a difficult thing to answer. If you are overwhelmed as a homeopath, probably you are not selling in the right book.
Right.
Now the another cluster which comes with a doubt,
Exactly.
होगा कि नहीं होगा.
Right.
Again, answer is the same. Let me take your case and let us define the case. And then there is a third cluster who are like they know कि मुझे नहीं ठीक. I am coming with your hope. You can try. And answer is again the same.
Right.
Let me take the case and let us define the case.
So everything is like case taking is more important, and then you give the answer according to the case what you have received.
Now there are multiple stories. I'm telling you, it looks like a very wise answer, but a lot of bluffs. Every one of us has now made multiple bluffs. Like this overwhelming is like a monkey sitting in your head because
Yeah.
a homeopath want to treat each and everything and every patient. So which cases to take, which cases to reject, and what to answer.
Right.
In fact, that sometimes our overwhelmingness makes false promises.
Exactly.
Which are counterproductive.
Sir, I
So
remember when I was a student and I was learning with a pediatric sir, and his first lecture with me was what not to treat. You should learn first, and then you should start your clinic. So, अगर आपको वो आ गया कि what not to treat, then every cases is with you. But patient को देख के आपको पता चला नहीं नहीं this should not be treated by me. Let me refer that patient, right? Better is to refer, then you have a very safe practice and you will never fail in your cases. So ये learning बहुत important है, where not to like handle the cases. Everything is not our cup of tea.
that's a golden advice given to you by our pediatric.
Thank you, sir.
Was given to me with a physician whom I was working with. Which
Right.
to reject, say, learn to say no.
Yes. Yes. This
So
is very important.
yes, so the
Sometimes we are so much excited with the number of patients and we are more obsessed with the number of patients कि ये चला जाएगा यार, इसको कैसे मना करें.
insecurity which every human being has, as
Exactly.
a homeopathy is
Exactly.
also that.
Exactly. That's very true, very practical. कि
Gradually, we are learning to curb that monkey which is coming.
exactly. Sir, how you tailor the individuality pattern in your cases with the patients, and how differently you like specific conditions also ना, जैसे कि exacerbation आया, acute condition आ गए patients को बीच में, तो how you specify or treat that particular situation, आप दोनों चीजों को कैसे करते हैं प्रैक्टिस के अंदर, एक ओवरव्यू चाहिए हमें कि बहुत सारे मेथड्स हैं, जैसे कि कॉन्स्टिट्यूशनल रेमेडीज वी आर गोइंग गिविंग, एंटीमास्मेटिक वी आर गिविंग ऑन द बेसिस ऑफ थेरापेटिक्स, वी आर प्रिस्क्राइबिंग मदर टिंक्चर्स, वी आर प्रिस्क्राइबिंग LM potencies and different other methodology, we prescribe biochemists, there are different methods we accepted in homeopathy, but what is your approach to deal with that pathological cases?
Yes, so let me tell it, put it very practically and very honestly, which I have been doing since years. So every case and every other case, once we take the case, we get the case. And then what symptoms we are having, that will define the approach. So I will share 4 or 5 cases bit later in the meeting.
Yes.
But then when approach comes, there are variety of approach. Like the approach very close to my intellect and heart is the Boningason's approach.
Right.
Why Boningason's approach? Because in Hahnemann's time, if you look at the journey of Hahnemann, like in 1796, the word homeopathy came, was given by Hahnemann, and then it really passed away in 1845. So roughly
Right.
Hahnemann had lived for 49 years with homeopathy.
Right.
Last 11 years of his life, he was practicing flourishingly in Paris.
Right.
Paris books are very popular. But inside that, during that tenure, he gave 6 editions of organ.
Right.
And sixth edition was posthumous edition, everyone know about it. But then every time he added or subtracted something. There were some newer approaches, like miasm comes into picture in the fourth edition of organ. Dynamization comes into third or fourth, I'm forgetting, but third or fourth edition. He
Right.
was also into material doses. But then he was minimizing the material doses. He was only giving that which was enough to stimulate a patient.
Right.
Right?
Exactly.
So again, so this is the first approach we must in curve, whether you're taking Boningas's approach, Indian approach, or Shankaran's approach, or Sarkar's approach. These
Right.
doesn't go.
Right.
This I try to see I inculcate in my practice. That stimulation of the right dose. Again, it's a questionable thing. What is the right dose?
Right.
We're speaking on that currently, but then this is then another is Hahnemann's two lieutenant. One was Jar and one was Boningason, whom Hahnemann appointed to prepare something like repertory. So
Right.
Jar also prepared a repertory. Boningason also prepared repertory. But Hahnemann accepted whose repertory?
Jar's repertory.
Boningason's repertory.
Morning Wilson's
Jar
repertory.
was more of like a pathological kind of repertory.
Right.
So we didn't disregarded Jar's approach.
Yes.
The book called Jar's 40 Years of Practice.
40 years of practice. Right.
Unthinkable, unimaginable cases and things what he gives in Jar. A small success story from Jar's case, because since we're talking about pathological cases. So I was treating a boy, this is in my PG days. Now this boy was 7 or 8 years old and he had alopecia universalis. Not a single hair on the body.
Oh,
Not a single hair on the body. Like even eyebrow or nothing was there. And
right.
it started after his mother passed away.
Oh,
His mother suddenly passed away. He was living in a very small village. And
right.
since her mother passed away, he started going to the temple nearby. And the evening Aarti, he was the person who invariably will be present. And he would be that playing that Mandir Ka Ganti, the bell in the temple. Till the Aarti and the evening procession gets over, he will be there. So he became extremely religious. And he became extremely responsible. For me, these two symptoms were very important for me.
Yes.
So disposition change, what Organon mentioned, the change in the disposition, mental or
Right.
physical. So this was a clear-cut change in the disposition. He developed this alopecia universalis after death of the mother.
Yes.
There was some impact of grief and all.
Exactly.
Happened to me that I was at that time reading Jar's repertory. And I came to rubric alopecia totalis, and there was only one remedy in it, oral metal.
Oh,
Okay. Now combining two wisdoms, extreme religiousness,
yes.
of Greek, highly responsible, and universalis or alopecia totalis, combine these two. Aurum met one and few doses, like within 3 or 4 months of span, the boy got every hair in his scalp.
Oh, that's a wonderful, wonderful case.
Yes, so this is a pathological case, number one, but then approach taken was yes, I used jar. But
Yes.
then in the background, I was using the whole mental symptoms which are disproportionately different than what it used to be before the disease.
Yes.
So
Change after the mother's death. What changes
yes,
have happened?
yes,
Yes.
and he was not religious before that.
Yes.
He was not religious before. He was not so responsible
True.
before that.
True.
So this is one case. So this is one approach. Like I use jar
Yes.
in this case. Now at the same time, the another lieutenant of Hahnemann would use. Right. So Wolingerson prepared a repertory on that 7 chapters where
Yes.
he uses the analogy, grand generalization. What is for a part applies to the whole.
Right.
Now in modern day homeopathy, contemporary homeopathy, even that approach still works wonderfully. And I've been an ardent follower, believer of Boningas's methodology, simple book called Therapeutic Pocket Book.
Yes.
Again, and that what was the connecting dot you were talking about in success? Like Dr. T.P. Rastogi used to come to our college, he used to be at that time president to homeopath to president of India. And you
Okay.
talk a lot about Boningas. And incidentally, I had experience of working cases with Boningas's approach in my college days. So I
Right.
had some experience of working with 15, 20 cases. So just knowing about the repertory, but as I insisted about it, I started going deeply into therapeutic pocketbook. And incidentally, Dr. Munjal also came into picture. He was also keen to work on that. So we started working cases. We actually worked on cases of Boningas and we tried to understand their mind in treating pathological cases. So we actually were working out bogus cases and Boningason's cases, which gave us a very different insight in treating pathologies or any disease through therapeutic pocketbook. So there is one approach.
Right.
And there is a myth that Boningason is used to when there are pathological cases. And it cannot be used when there are mental cases. It's a myth. Boningason's repertoire is nearly 40-45 mental symptoms,
Oh,
which are very common symptoms which any ordinary homeopath can even do. Any student can also use it. So
Right.
that is the effort invariably I use in my practice. And
Right.
I must say that 126 remedies given by Bobby Vasan, they were proven during Hahnemann's time.
Right.
उसको question नहीं कर सकते. So कभी कभी short results are.
Right.
So this is another approach. Then there is Pathak's approach, which I take now.
Yes.
Okay. Pathak's a wonderful repertory, small repertory, alphabetical repertory. Again, it is based on bogus synoptic key.
Right.
This is one thing. Now coming to a very modernist approach, I cannot say modernist, it was mentioned in Hahnemann's literature also, the using of isopathy sometimes
Right.
or tautopathy sometimes. So I will tell one or two cases later on of isopathy and tautopathy both. But that is also an approach we sometimes need for treating these pathological cases.
Right.
And of course, miasms. Hahnemann came to miasms because he himself was stuck into cases which were recurring back.
Right.
Which forced him to discovery of something like observations in miasms.
Yes.
So there
That,
is also an approach. The organopathic approach, no source are code. So everything comes. Therapeutic approach, or single like a remedy which covers everything. So there are multiple approaches.
yes. 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 So one question from my side. As a homeopath, we always believe that there should be a single remedy, monopharmacy, single doses. Right. How is your experience with pathological cases? Do it really suits to that also? Practical approach, I'm asking,
No,
not
no,
theoretical what we
I
read.
would tell totally from the heart and from the practice what I am doing.
Yes.
So there can be series of remedies
Yes.
in pathological cases. Now, if you look at Hahnemann's Paris case books,
Right.
there is a book called In Search of Later Hahnemann by a homeopath called Rima Handy. She's not a homeopath, she was a researcher. So Rima Handy actually went to Paris, not Paris, but there is a place in Germany, Robert Bosch Museum, where she actually saw cases, Hahnemann के live manuscripts.
Hmm.
Try to translate the cases. उसके photographic evidence भी आपको उनकी book में मिलेगी. And he was
Hmm.
trying to crack the Hahnemann's practice in Paris.
Right.
So in that book, like Hahnemann के सबसे ज्यादा से ज्यादा टाइम किसी केस में गया तो 45 days he was curing the cases.
45 days.
5 days that he was curing the cases, whoever cases were there. Now, in Hahnemann's cases insert documentation, he is giving starting a case with sulfur, then using lycopodium, and then using calcarea carb, the SCL cycle, and with some reasonings, and he used lot of remedy relationships.
Right.
And Hahnemann was having only 99, 100, 110 remedies with him. So he was playing with the remedies. Okay, now this remedy has been given. There is something like a next stage of the remedy. So at that stage, he would change the remedy. So I
Right.
would always go with the emerging picture.
Right.
What is the emerging picture? Now we can connect emerging picture with what Harry says, the law of cure, how the cure should be. That is also an emerging picture. And then there can be something like nosodes का use कहाँ पे करना है.
Exactly.
It is not polypharmacy, but stage-wise giving a remedy.
Right.
So I started developing interest in remedy relationships. So this is one thing. And in certain cases, really pathological, I've been using 2 or 3 medicines at a time. Multiple
Right.
times in certain pathological cases. But
Right.
I try to see that I use the remedies which are related.
Right.
Okay.
That is complementing to each other follows well better, right?
Yes. So certain,
Yes.
but not definitely never in cases where the totality is very clear in front of you. Functional cases never require such approach. But I'm talking about some gross pathological changes where we have very limited scope of treatment and such things. Like
In
let
other
me
words,
give
when
you
we want to
example of
palliate the condition,
let
just
me
need a palliation.
put it very plainly like a patient of cancer I'm treating. And the
Hmm.
patient is already undergoing some radiotherapy. So along with whatever remedies I am giving, invariably I would try to use radium bromine this.
Okay.
Okay, to curb the now this is something a orthopathic approach.
Right.
Using whatever other remedies I am giving. And I presented this literature in wherever I've been speaking. So it is not that it's something from secret sauce which I'm selling here. But then yes,
Right.
I use definitely. And
Right. Right.
many times in very gross pathological cases where chemotherapy, radiotherapy is going on, even if the patient is having a very good constitutional picture, remedies are not working.
Right.
Because there is something like now the state of the patient is kind of a cocktail now. So at this time, better to go with some organopathic remedies
Right.
and then see what comes up. And if the still the constitutional picture remains same, there is a time where you can introduce Steffi in one a constitutional remedy. Steffi इसलिए याद है because in one case where there was a deep trauma inside and gross pathological cases of for CA breast. मुझे पेशेंट मतलब दो जगह अलग अलग जगह से मैंने केस दूसरे से भी एनालाइज करवाया. Everyone came to Steffi and Steffi was not at all working.
Right.
All potencies, even LM potencies, everything came not good. But very, very sure. And then we shifted to something very local remedy. We started the case with carcinosin first. And gave something like Rubens, looking at the ulcerative stage of the
Right.
partially started healing. But that state was going on. Then how the time came when I gave Steffi and it started working.
Yes. This recently I have attended a Pune seminar of Dr. Borkar sir and Dr. Dhanipkar sir, and it was related to kidney pathologies. And similar things they also talked about. There is something like constitutional, there is something like anti-miasmatic, but there is something also which is called as a pathological specific remedies, which are the smaller remedies you find in Borike, but still they need to trigger to come back with your constitutional drug. So every time it is not like constitution will clear up everything in every cases. You need some triggering factor to activate so that you come back to your constitutional drug.
See, I would put a very different analogy.
Yes.
If I talk about this point, it is different than what homeopathy is. But then everyone knows about Jesus Christ.
Right.
Right? But then before that, he was Jesus.
Right.
The whole journey of Jesus to becoming Jesus Christ was nearly 300 years. Okay, before even Christianity as a religion was established.
Right.
But then in between Jesus and his followers had their own versions of Jesus, who made him Jesus Christ. Same
Right.
is with homeopathy. See, we are a 250-year-old science.
Right.
Hahnemann, the contribution is of 45 years. Rest all the followers, which includes us also, and the coming generations also, they are
Right.
going to add in the things
Right.
to make this science like a greater science. I would
Right.
won't say perfect science.
Right.
Because science is always evolutionary. There cannot be an end to science.
Exactly. Definitely.
50 years to judge homeopathy is the best or to say homeopathy is not working is too early to say.
Exactly.
More and more testifying through cases will
Right.
happen. So is with the approaches. So multiple approaches will be coming and we must implement them. Because Hahnemann himself, if you look at, he himself was trying out various things.
Exactly.
And what we know from Hahnemann is the aphorisms in the organ. But उसके पीछे का जो experiments what he was doing, उसके बारे में we are not talking.
We are not talking about exactly.
For writing that one aphorism in organon, I'm very sure he must have some 100 failures.
Definitely, trial and error was there to prove that this is the right thing I'm doing now. This is the exact thing.
So the experimentation should always go on. And it is not like we are risking patients. Like, no, we are not at all trying to say that. But various approaches. You see, multiple approaches are not coming. The
Yes.
principle remains the same. The 7 principles remain the same. But the composition, what a musician does, can be anything. Like,
Can be anything. Can
there
be
was a
changed.
time of Kale Sagal, and there is a time of Preetham Singh also.
Right. Definitely. Very true, sir. Sir, what precautions a homeopath or early practitioners or even an experienced practitioner should take and while dealing with such pathological cases?
First
Because
is a
this
promise.
is don't
Promise or don't promise, but the word you choose for the precaution. And define what is to be treated in the case.
yes.
If you look at aphorism number 3, I do not have argument with you or not, but then I think the listeners or the viewers must be having aphorism number 3. वो क्या बोलता है? Aphorism number 3 talks about knowledges.
Knowledges.
Various knowledges of disease, of medicine. So if we go to the extended version of that aphorism number 3, like today is the era of AI, or let us not take AI but Google. So various knowledges are available. Are we using that knowledge?
Yes.
It doesn't end. So disease का भी pathology का pattern भी change हुआ है. Hahnemann didn't even add something like a stethoscope.
Yes.
We are having something like our watches can even take ECGs now. And predict that okay,
Very true.
this patient is having a cardiac arrest. So are we adapting to that? Are we integrating, aligning ourselves to this, and not breaking the rules of homeopathy, the seven principle, the seven sur?
Exactly.
Are we adapting to that? So our all advices, all precautions should be in that way. So in
Right.
this case, at least it is easier for us to understand the concept of disease, biological or different concepts of diseases, and
Right.
see what is to be cured in the disease. Because see, every disease, or if you take a simple book of Harrison, okay, Harrison's medicine, every one of us read Harrison's
Yes.
principle of medicine. So उसमें prognosis लिखा होता है,
Exactly.
right? So we are not reading prognosis, and उसमें probabilities भी दी होती है. So if we are able to look the probabilities and see where now homeopathy can make a difference, I think that our answers will be smarter and realistic and in the benefit of the patient.
Right.
Uh, a simple algorithm I always set in patients, like patients of CA prostate, suppose, okay?
Right.
Now, probability of cure rate in CA prostate is much more higher than any other cancers. So many times, this cancer specialist use this word that if you want to have cancer, then have prostate cancer because it is curable,
Exactly.
treatable, not curable but treatable.
Right.
And I do the same analogy in homeopathy also. I go to the books. In the tumors where chemo and radio are giving better recovery rates, a homeopath also can give a better recovery because those are tumors which you
Right.
can be treatable. This algorithm we always use. Very
Right.
simple trick. No, this is nowhere. There's no written rule in that, but then I am using this practically.
Yes.
Open a book like Harrison's Oncology, open it, read the disease, and read every time before treating.
Exactly. So you
What,
need to know more prognosis, but also of the each and every cases
what is to be
dealing with.
treated in the disease? What is to be treated in the disease? One.
Exactly.
And then another like different way I would look at aphorism number 2. This
Hmm.
talks about
Gen-
rapid, gentle,
Rapid
permanent, okay,
restoration of health.
restoration of the health. So in your case, see yourself where you can be gentle, where you can be rapid, where you can give a permanent restoration.
Right.
In every case, this is not going to be possible.
Definitely.
It is a very relative term. And then again, going to aphorism number one, physician's high and only mission. So yes, our mission is to see which doctor do not want to treat their patient.
Definitely.
Again, coming to aphorism number 3, what is to be cured in the disease.
Right.
So I would
Right.
say that first be a doctor who uses homeopathy to treat his patient.
Right.
So we are physicians first. My
Very
weapon will be homeopathy.
right. Very, very, very true, very practical, very scientific answers I'm getting from you, because this is the thing we need to make people aware कि it is not like कि हमने बोल दिया हो गया, but it's the answer should be more precise and scientific and how it is working. क्योंकि patients has a lot of questions. That's very true. कि patients has a lot of questions. They have lot of doubts. Some people understand कि ये magic हो जाएगा कल रात का आज दवाई ली कल तो मैं एकदम ठीक. So every time this doesn't work. And as a doctor, as a physician, we should know our limitations. We should know the disease limitations. We should know the prognosis. Everything is very important. Read all the documentations and the books. मैं हमेशा कभी मैं जब लेक्चर लेने जाती हूँ सर तो मैं हमेशा बोलती हूँ not like that, but be a allopath to see the disease and treat like a homeopath. So अगर आपको पता है कि आप as an allopathed diagnosis आपका क्या है, आपका prognosis क्या है, क्या investigation मुझे चाहिए, किस तरीके से मुझे deal करना है, then choose your homeopathy. So that is the best thing integrated, what I tell, the integration part. So it is very required, and this will be the future of homeopathy. If you see like an allopath and treat like a homeopath, then only you can integrate better. So that's what I believe. And today that thought has actually came from you also. So I'm very grateful कि मेरे thought पे किसी मतलब किसी ने ऐसे थप्पा लगा दिया, मुझे ऐसा लगा कि नहीं, I'm totally correct about it. Okay, so coming back to, can we discuss some few cases about your that has a good experience, or even not a good experience? That's okay, but
We'll take
how
some
you did it?
5 cases in a nutshell,
Yes, sir.
okay? To
Yes, sir.
start with the case of this woman had polio, okay? When she came to me, she was 33 years old, and she had her ejection fraction was only 15 to 16%.
Okay.
The relatives would used to bring her in a wheelchair because like little movement would cause respiratory distress and everything. Okay, now this case, I at whatever maturity I was having, but I couldn't find any other much of the symptoms in it. And I put her on a medicine called convalescent magus. Now, pathology, we are discussing pathological cases. So, I will put up some pathological cases in where actually pathological thing is. But I'm just opening my book and just want to read
Right.
a couple of lines from convalescent magus so that we don't miss out. But then, what history I was having, let me open convalescent magus. Now, it's a heart remedy. It increases heart section, make it regular, and of use when the ventricles are over distended and the dilatation begins, and when there is absence of compensatory hypertrophy and venous stasis is marked. Dyspnea, dropsy, enuresis, and asarca. This everything was present in the patient. Okay, this thing was present. It is in another remedies also like Adonis vernalis also. It is present. So this made me to give her convalescent magus. And it all happened after a cardiac arrest. And this
Right.
remedy has already a angina effect.
Right.
Now, after this remedy, when I ended the case at nearly 1 year, I repeated convalescent magus repeatedly, like anything, like 34 multiple days daily. At the end, when we completed the case, she was at 52% ejection fraction. Thanks to the only one remedy given in this case, pure pathological similar
Correlation.
approach.
Right.
Now, in one case of similar kind of LVH, sorry, I gave Adonis vernalis.
Okay.
It's a very interesting analogy. Again, going to boric of Adonis vernalis. Now, Adonis vernalis is a remedy where complaints come after some episode of influenza.
Right.
Okay, now, this patient had COVID, very recent one case, okay, 2 years back, and developed. Yes. So after flu, first line written in Adonis vernalis,
Yes.
a heart medicine
After
after
rheumatism.
rheumatism or influenza.
Yes.
Into this analogy I fit. And again, this patient improved a lot after Adonis. So these are some very different approaches, like very simple approaches, but you are connecting a symptom to symptom.
Right.
Okay, now knowledge of disease is very vital in this. Knowledge of remedies is very vital in this. And causative factor.
Right.
Connected these two things and give Adonis a very reasonable, good, fair rate. So
Right.
this is very different kind of okay basic approach using simple boring. Now another case of heart disease, like again a rheumatic heart disease, and this patient was also in a stage where she was taking warfarin. Okay, and deeply, she was having some internal traumas coming from a very conservative family. After marriage, very conservative family, not allowed to move. Previously, the family was very modern, going out, same culture, same religion, but things changed after marriage. So I gave her Naja in this case. Okay, again, considering the emotional state, emotional experience, and the heart, and the rheumatic nature of Naja. Everyone knows about the Naja and
Yes.
rheumatic heart
Yes.
disease. So we could reduce the doses of warfarin gradually. Now, if you immediately decrease the dose of warfarin on yourself, you are risking the patient's life.
Yes.
Okay, the golden advice, you shouldn't do this. Let the physician do this,
Exactly.
right?
Very true, sir. Very true.
Let the physician do this. Okay, certain remedies you may, but not like this compromising patients. Okay, if she was
Exactly.
down with PDM, even one dose of warfarin she would miss, she would throw out an episode of breathlessness.
Yes.
She got hospitalized and everything. So don't do it. And
Exactly.
again, now there is a remedy how to give. कार्डियोमायोपैथी डेवलप हो रहा है कैसे कैसे देंगे स्नेक रेमेडी take the time. Okay, and then again this parallel or remedy called adonis again was going that parallel in this case later on, so we
Right.
could help her. We could reduce the dose of. So now I have an 18-year follow-up of this patient.
18 years.
Yes, and going well, reasonably well.
Right.
So this is another approach I'm talking about, like hardcore prescription based on base of some deep mental emotional symptoms experience
Right.
and pathology, and also later on topped up with a remedy which is very much organopathic, like Adonis varieties.
Right.
Another case, if I am allowed to say one more case, if you have time. Now, this case is of ankylosing spondylosis. Okay, now ankylosing spondylosis with the HLA-B27 gene positive, receptor positive. Okay, so this
Yes.
patient was 31 year old when he came to us. So I took the history and everything, and I came to remedy called ranunculus bulbus.
Right.
I started giving it, and at that time, the patient was unable to wake up in the morning, like 7 a.m. He would wake up, and then he took nearly 1.5 or to 2 hours to just get up from the bed because body became so stiff.
Hmm.
So he would do some stretching, warm up, and after 1.5 hours, he would get up from the bed. And he
Right.
was taking nearly 3 to 4 diclofenacs per day so that he could work. So as of now, again, like very initial years of my practice, but he is totally symptom free. He's riding bike and he's doing his work and everything, not a painkiller, single painkiller, like almost since now 15 years. So
Right.
HLA is going to be there because it's a hereditary thing.
Right.
And now the question again comes, another patient comes with HLA B27. कि इसको जीन को नेगेटिव कर सकते हैं हम हमारी मेडिसिन से तो नहीं कर सकते. And we can free the patient from pain. So again, this is an interesting case, pathological case, ankylosing spondylosis, patient with a bamboo spine, but moving. Because otherwise he would move like this.
Yes. Yes.
But then his flexibility is restored. Bamboo spine has not been reverted.
Definitely.
The functionality has been tremendous, like shifted like. So these are 3 or 4 cases which I can share.
Right.
Another like approach which recently in 3, 4 cases, these all cases are of post-COVID hip joint necrosis.
Yes. Which is very common.
Later, these are all young people in mid of 30, 32.
Yes. Yes.
Right? So prednisolone दिया गया था,
Hmm.
solumedrol दिया गया.
Hmm.
So if I have an outright history of some prednisolone or solumedrol being given, so I started this patient with giving prednisolone.
Yes.
Okay, so and it has been helpful to us.
Yes.
Till the constitutional picture comes, I can't say these patients are cured because I only have 1.5 years of follow-up of them. But their mobility has improved. No requirement of painkiller. They're able to ride vehicles. They're able to do moderate exercise. Could walk for 2 or 3 kilometers. So this whole thing, and then the constitutional medicine always there. So this
Yes.
is also an approach which we call as a synthetic medicine approach or autopathic approach. So this is another approach in treating this kind of pathology. It's not every time.
Yes. Very true. Sir, this prednisolone was case I have discussed with Dr. Sharon ma'am. She is practicing in Pune. She was also speaker on our channel on rheumatism. And she told us that whenever there is a history of long prednisolone, you should start the case with that. And then you will get the clear picture of the disease. And then you can prescribe whatever is coming after it. So this I've learned from her. And today you are the second person talking about this thing. And it was very true. Okay, we have to clear the background like before getting
Again, now see, this is the concept.
yes.
Okay, this is a conceptual prescription which I am doing what the doctor is doing.
Yes.
So if we have some 40, 50 cases like this, case series like this, then we can say that okay,
Then
it's
we can say this is
pilot.
working. Yes.
Otherwise, the same approach is not definitely going to work in every another patient.
Every another cases.
It
Yes.
won't work. It
Yes.
cannot be replicated.
Right.
But then it's an
Actually,
approach. So we
yes.
have to have more and more cases of it. So case series of similar cases always help. Say
Yes.
maybe 20 cases of prednisone effect, then I can present somewhere and tell, okay, no, this is a pilot.
Yes. That's
Then
very
it goes to a next phase one study.
yes.
But then what we can do is small pilots in our clinics. And keep a record of the cases, see the improvement ratio, see the criteria.
That's true. That's true.
But
Sir,
they don't do the disclaimer I'm adding in every case it won't help.
we won't. We won't.
I'm upfront telling the approach which I do.
Yes, yes, definitely, definitely. We are talking about your approach and your practical experiences only. We are actually not claiming anything in our channel. We are just discussing about the approaches which a homeopath can give to a patients. Sir, I want to just ask you, when a patient can choose as in a pathological cases, the homeopathy as the primary line of treatment. Any experience with it?
Out and out like cases of psoriasis, yes we can. Out
Yes.
and out. Out and out cases of eczema, yes we can. Out and out in like cases of like rheumatoid arthritis, a certain level we can.
Yes.
Now we have that confidence. Okay, now we can taper off and we can
Yes.
keep out and another cases would be like respiratory cases, like bronchitis, allergic bronchitis, and even
Yes.
asthma. Now we can. Now we have that
Yes.
confidence to go over.
Yes.
Gastric ulcers, yes, we can. We can. So these are some common like personal experience. Okay, personal experience in cases of tuberculosis.
Right.
Now pulmonary tuberculosis and cervical tuberculosis, if it,
Right.
and Cox abdomen.
Right.
So someone in my practice confidently, now again it is a very relative thing. For respiratory pulmonary tuberculosis, there is always an AKT available and people must take it.
Right. Definitely.
Because there's a government protocol.
Hmm.
But cervical tuberculosis, gland, or Cox abdomen, I'm getting reasonable results only with me. In
Right.
4 or 5 cases, using this remedy and all have gone.
Right.
But totally without AKT. Again, a disclaimer. It should not be cut, copied, and pasted everywhere. But
Exactly.
then, yes, if you ask me really by heart here, these 2 cases as a researcher we must take up. We have
Yes.
to, and these are very well treated with medicines.
Right. Right. Sir, do we integrate with conventional medicines also? Like every cases cannot be dealt only with the homeopathy, and many a patients with the pathological cases comes after taking the conventional methods, and then they need the homeopathy as a line of treatment. So, can we integrate with them, or like
Must integrate
they can?
everything. We must
Yes.
integrate everything.
Yes.
The safest approach is to integrate.
Right.
Right? Let us take example of rheumatoid arthritis. Okay, let me
Right.
start with the case upfront. Now,
Yes.
this case has a lot of deformities in the hand. Okay,
Right.
35-year-old female, and all muscles were also getting lax, her joints were getting lax, and the typical Marwadi female has to do lot of work in her family responsibilities and all a rich family, but जो उनके routine थे उनको करने ही पड़ते थे.
Yes.
Even holding a glass was like दो हाथ से ऐसे ग्लास पकड़ के इधर रखना, but she had to do it. And she
Right.
was on medic prednisolone पे थे. Methotrexate, Polytrex was going on, Lephra was going on. So we started the treatment with a deeper constitutional remedy. We started this case with Persitin. Okay. Now patient started improving after some 4 5 months and something. Okay. This rising potency media, LM potency, improvement. Gradually, I myself tapered off Lephra. 3 months पेशेंट दिया नहीं लगेगा तो आप लेफ्रा ले लो ठीक है 3 months गुड ओके लेफ्रा स्टॉप किया धीरे रह के SCQS को टेपर ऑफ किया
Right.
पेन किलर टेपर ऑफ नहीं किया एज एंड व्हेन रिक्वायर्ड उनको पेन किलर नहीं दिया धीरे से हमने करीबन 2 साल के बाद पॉलीट्रेक्स को
Hmm.
SCQS रखा और धीरे करके लगे 3.5 year SCQS हटाया पेन किलर एज एंड व्हेन नेसेसरी नाउ currently 5 year she is not taking any of such medicine.
Hmm.
Only on homeopathy. Medicines are going on. Later on, I shifted this patient to Viola odorata. So I use lot of remedy relationships.
Right.
So in pathological cases, the next layer would come. You should be ready to align yourself, accommodate yourself to the next layer of the remedy.
Right.
So after Viola, again things are going good. I'm giving her in repetition, but the strength in her hand is better. Not dependent on painkiller. She's now 47, 48. So 12 years follow-up again. What else? We
Right.
5 years she's
Exactly.
free from 5 to 6 years she's totally free from any other, like not even taking pain. She's
Right.
able to bear the pain, manage the pain, and the holding capacity of things, you know.
Right.
So
Sir, one personal question from my side. Can we reverse the deformity in the rheumatoid arthritis?
no, I would say.
Yes.
Outright no, I would say.
Actually, I was believing the same, but I just wanted to know because I usually don't promise the
So
patient.
that's how then I do not know, but at least I'm not seeing that.
Yes, yes,
Personality, definitely we can improve a lot.
right,
So no bold claims. We cannot do such claims because they don't happen. Frankly, they don't
right,
happen.
right.
For that, like some 1,000 or 2,000 cases of documentation is missing.
Yes, very true. We'll discuss someday about the documentation part, huh, sir? Because I think you are the right person to talk about it, and
Build up.
not personally also, and on the YouTube channel also. We'll discuss how to document everything because
Surely,
this is
surely.
the need of the time. I would say this is the need of the time,
And there are
and
easier way to document by the way. It is not that tedious.
right.
There are easy ways to document.
Yes, that will we will discuss like how to do it very easiest because in a busy schedule somehow we skip that part. We skip because we are more obsessed with the patients and treatments and results and all that. So we think यार कल करेंगे यार परसों करेंगे उसमें वो रह ही जाता है फिर. So
Something which should be like regarding documentation, if you want to copy, cut, paste is from the ICR people.
right.
Thorough
Yes.
documentation of every cases. So I'm frankly speaking, I'm just copying.
Okay. Okay, sure, sir. Sir, a newer डेवलपमेंट और रिसर्चेस बहुत चल रहे हैं इन दिनों में. बहुत कुछ नया नया होम्योपैथी पे आ रहा है, होम्योपैथिक रिजल्ट्स पे आ रहा है, मेडिसिन पे आ रहा है, न्यू मेडिसिन ऐड ऑन हो रही है काफी हद तक. तो इसके साथ एक बडिंग होम्योपैथ्स को, एक न्यू कमिंग होम्योपैथ्स को कैसे अपग्रेड रहना चाहिए, रिसर्चेस, ये पब्लिकेशंस एंड ऑल दैट.
First question to everyone is, have they read sixth edition of Organ?
दैट इज अ क्वेश्चन मार्क.
Have they compared fifth edition and sixth edition?
राइट.
And Hahnemann, in his later life, was advocating LM potencies.
राइट.
Hahnemann was also giving the same centesimal scale medicines, but in plussing method.
राइट.
Prism number 248 to be precise, where he gives clear guidelines. And
राइट.
again, he was in his experimental phase. Again, coming to the book Remindly, when Hahnemann के case हम देखेंगे तो we'll see that in some cases he gave some 400 drops of water and then 2 drops of medicine. In some case he would put some weird like 800 ml of water and some 10 ml of water and different things.
राइट.
So it was experimentation, but what to be present in a book. So first, have you read the latest organ available? And I'm very sure if Hahnemann was alive today, there must have been the 250th edition of organ. Because he was over he was a scientific brain. He was evolving himself.
राइट.
So coming to the newer researches, like something new for me, like it happened in Turkey, was signaling molecules. So some new kind of potencies which are now coming up. Signaling them. So I do not know, I'm not an expert on that, but I know brief about it. So how about using that or knowing about that? There is also now a research which is going on, like we are diluting the medicines.
राइट.
Next potency we dilute, next potency we dilute. How about we only give strokes?
राइट.
Like 10 strokes, it is 1 is to 99 dilution, which becomes 1C. 2C is that again the 99 dilutions from one
Yes.
point from then 10 stroke. How about the same stock bottle, 10 strokes, and then again 10 strokes, and then again 10 strokes, till 1 M means how many strokes? 10,000 strokes. So this is also be now research and experimental. Again, the big data will be coming gradually, but then this is the latest thing which is going on in build up of solar. But approaches, yes, multiple approaches are coming. And again, not original approaches will already remain original approach, but definitely some kind of tweaking will keep happening. But then, like for us, the best research would be like case series. Read case series. Everyone understands case series. Read case series and see. Like double blind study can be a very, very good thing everyone can do. Like
Yes.
when you're talking about like integrated approach, take a case series, you have worked something, now next level, do a double blind study. Again, this patient conventional medicine will be going. And in this patient conventional medicine, what we do? And taking easy things, easy to treat,
Right.
like allergies, urticaria ले लो,
Hmm.
तो देखो क्या आता है आपको, कॉन्फिडेंस बिल्डिंग एक्टिविटी सही,
Hmm.
rather than taking cancers शुरू से ही, ये
Right.
आपको
Very
भी
true.
पता है कि आपको करना
Hmm.
है, and
Very
we cannot be blaming in that.
sir.
एक पॉइंट
This,
और एक पॉइंट और,
हाँ हाँ सर बोलिए.
लाइक ऑन्कोलॉजी की बात करते हैं. See, oncology, whether you are taking chemotherapy in India or in US or
Hmm.
in England or in Africa, there are clear-cut guidelines. एक पेशेंट का स्टेजिंग होता है,
Hmm.
वो स्टेजिंग पे जाके आप पढ़ोगे ना तो प्रोटोकॉल्स क्लियर है. दिस इज एन ओपन सोर्स थिंग. यू कैन आल्सो गूगल इट एंड सी ये कीमोथेरेपी का ये प्रोटोकॉल है, कितने देने हैं. तो दिस इज ऑल ओपन सोर्स डॉक्यूमेंट. ठीक है, तो हर स्टेज वाइज देयर इज अ डिफाइंड अप्रोच.
Right.
तो वो सीए ब्रेस्ट लेते हैं, सीए ब्रेस्ट में भी ट्रिपल मार्कर पॉजिटिव है, नेगेटिव है, ये स्टेज पे पेशेंट आया है, नोड्स आगे गए हैं तो यहाँ से शुरू करना है, मेट्स हो गए, लीवर पे मेट्स गए, लंग्स पे मेट्स गए तो यहाँ से शुरू करना है. So everyone is knowing what they are doing. This is somewhere missing in India.
Exactly. Very true.
Yes.
Very, very
How
true.
we can integrate this kind of standardizations in
Right.
treatment? Again, not tweaking the individuality, the principle of individuality. Nowhere breaking that rule. But then how to develop such kind of protocols easier to do. This will be the future research, for at least from in my work.
Right, right. Very, very true. Very true. This is the need of the time. We need to understand because that is the point. Many a time student also ask for ki different approaches, different way of treatment. Sometimes confuses also. कि इसमें ये भी मेडिसिन आ रही है, इसमें ये भी मेडिसिन आ रही है, ये भी मेडिसिन आ रही है, तो कौन सी देनी है, कब देनी है, कहाँ देनी है. तो एक एक प्रॉपर एक गाइडलाइन होगा तो देन इट वुड बी वेरी इजी फॉर होम्योपैथ्स ऑल्सो एंड कॉन्फिडेंस लेवल विल बी डिफरेंट. लाइक
Yeah.
डाउट नहीं रहेगा क्योंकि आप एक किसी भी कन्वेंशनल डॉक्टर के पास जाइए, उनका वर्क मैक्सिमम टाइम डायग्नोसिस तक ज्यादा रहता है. देन इट बिकम्स वेरी इजी फॉर देम बिकॉज देन देयर इज अ प्रोटोकॉल टू ट्रीट इट. दे हैव अ लाइन ऑफ ट्रीटमेंट विद देम कि ये आपने सही बोला कि हर एक स्टेज पे उनका लिखा ही होता है, इट्स ओपन टू एवरीवन. तो वो जिस दिन होम्योपैथिक में होगा देन एवरीथिंग विल बी वेरी इजी फॉर एवरीवन. सर, हाउ यू सी द फ्यूचर ऑफ होम्योपैथी? This is very tricky question, but still.
Uh, like in current scenario, let us take the global scenario.
Right.
Where it started from Germany.
Yes.
So, what is the presence of homeopathy in Germany? Negligible. Okay, the land of Hohenzollern, the land of Hahnemann, the land of Jar, and the land of the legions.
Right.
Going bit forward, France, yes, they are adopting to homeopathy. They have adopted to homeopathy much. But then, if you look at overall the French culture, there are people who like to adopt to various other things. So
Right.
acceptance rate homeopathy का France में अच्छा है. Same with the Britain. Same is with the United States, but not in Europe.
Right.
Okay? Nothing in China, nothing in Japan, nothing in the Eastern countries like Thailand or everywhere. But
Right.
in India, Pakistan, Bangladesh, there is a wide scope, huge scope,
Yes.
because we have a lot of people to treat.
Right.
So scope of homeopathy in India is very broad.
Very.
But if we are losing the thread of research angle in it, we will sure die, because the era is coming up of evidence-based medicine. Again, evidence-based medicine is more of an outdated, old school term now. It was talked in 90s.
Right.
Probably when I took admission, evidence-based medicine. Now it is more like of a very different kind of genre which is coming up. It is more of all research. And homeopathy doesn't fit into the traditional form of researches and even modern day form of researches, because ultimately the game comes to the role of individuality. So
Very
in this case, double blind or triple blind study जितने ज़्यादा होंगे, we're able to prove ourselves more and more in a better way. Simple testimonials, yes, they were good for our practice. So individually, we are good. But if you look at the larger system
approaches.
approach,
Yes.
India may be producing 1 lakh homeopath per year.
Yes.
But then we should also see that how much impact we are making to the medical community, which is less. Yes, out of this, 10,000 people are flourishing in homeopathy. But then we are sitting in our clinics. And it is very individual thing. But as a group, where we are, that's a question. Where we are heading towards, it's a question. Of course, CCRH is very, very active doing a huge mammoth work. Okay, so that kind of work, if everyone starts doing, everyone start putting their cases in the case banks, imagine where we can reach. And we cannot match the Western standards of practice. Even allopathy practitioners in India can't match the Western standards because their whole protocol sets are very different. So if we look
Right.
from the Western medicine's point of view, we are nowhere. We cannot match that. But from Indian perspective, yes, we are flourishing. But again, if we do not add this angle to our practice, then it is going to be.
Then future would not be that bright. That's very
I
true.
won't say bad, but difficult times will automatically come. So we
Ye-
need to align ourselves to, again, aphorism number 3, knowledge of statistics should be added simply.
Yes.
Aphorism should be rewritten in the today's point of view. The translation should be in today's point of view. A lot of things can be added and tweaked.
Because everything has changed from 2050 years back, and now the generation has changed, the theses are changed, the prospect of seeing the science and the treatments have changed. So definitely we should also upgrade ourselves.
See, COVID itself made a lot of upgradations in our
Definitely.
healthcare
Sure.
technologies, deliveries, deliverables, right? No one was talking about quarantine now. Everyone talks about quarantine.
Yes, yes.
Again, quarantine is an old terminology.
Yes, वो PSM की book में sir, I remember we used to read that quarantine but never understood what is quarantine.
But then long COVID effects क्या होने वाले?
Hmm.
Are we able to align to that? Are we able to treat that? So this is a modern thing, right? And again, not breaking the 7 principles of Hindu.
Exactly. Very true. That is somewhat difficult also, but if we try to find a solution out of it, then definitely that would be a very important part to grow homeopathy in future. That's very true. And today definitely people would be like more aware of how to do a documentation. इस पे एक और करेंगे सर, डेफिनेटली करेंगे कुछ टाइम में कि
No.
डॉक्यूमेंटेशन को इजी करना, क्योंकि ये बहुत इंपॉर्टेंट चीज है, बहुत इंपॉर्टेंट है। ये मिसिंग है कहीं ना कहीं, बहुत लोगों में मिसिंग है। ये बहुत इंपॉर्टेंट चीज है। सर कुछ क्वेश्चनरीज, कुछ कमेंट्स है, अगर आप अलाउड करते हैं तो शैल वी?
Yeah, we can.
यस। सो इन्हा Nikon K is saying hello. So hello Inha, and she has requested for subtitles, but sorry, I don't have that system in my computer to do subtitles because I'm using MacBook and it is not supporting it. But still, I would try in the next live if it is possible anyhow. And did you have successful case deep depressions?
Yes, I have.
Okay.
I
Can
have.
you experience something about it? Okay,
Again,
share the
this is the
experience.
case of I treated this case with costing.
Okay.
Okay, now this case was like depression again can be classified into mild, moderate, severe depression. This
Yes.
case and not profound and not a profound depression. And the last one would be the bipolarity when patient goes into the stage of bipolarity. So this case of a profound depression. And in depression, okay, the symptoms which are coming, the patient experiencing sadness, and then there can be monomania, there can be hypomania, there can be hypermania. So if we go through the all depression as a disease, there is one classification by Hamilton. Now, Hamilton's classification probably all psychiatrists academically use, but how it can be used in homeopathy? Take your case and try to fit that same case into the Hamilton's criteria, and then do a self scoring, okay, where the patient is falling. XYZ score, whatever comes, and then evaluate every 2 or 3 months. Again, do the Hamilton scoring for depression, see what results come. But then every depression patient will be having one individual cluster apart from the sadness and crying and blaming and reproaching and all. So this patient depression, this patient was like very common symptom, very, very simple. And she would feel only and only better if she do some service to others. And she would be relieved in her depression symptoms. So this made me to think of giving her osticum, again repeated doses in higher potency. Because
Right.
again, depression patients, when they are already taking clonazepam or rivotril or certain things, a lot of hydrogenicity comes. Again, in these patients, we cannot withdraw the medicines from on our own. So let
Yes.
the psychiatrist do their job.
Psychiatrists decide, right? Very true.
The psychiatrist only gradually withdrew the drug, what he was giving.
Right. Right.
So profound, mild, moderate state, the patient come into mild depression, mild, so then eventually he's symptom free.
Right. That's true.
So in depression patients, always there will be one factor which will be deciding. But the tricky thing is these patients sometimes feel very happy. So it happened that when patient comes to you when he's in hypomania state, hypomanic state, he's a very sad face. You give XYZ remedy, even if you give an SL, chalo. 15 days के बाद he's into very hyper mood. Patient happy, doctor happy. एक महीने के लिए चला hypermania state, happy mood. Suddenly it falls. Okay, so it is both part of the same game. If you understand the hypermanic states in depression patients, you can treat depression patients better.
Yes.
Simple read depression in textbook, read in Kaplan psychiatry, and you need to understand hypermania states of it
Right.
because they are like illusionary, not for the patient but for the homeopath.
Right.
She feels that okay, I'm in the right direction, I'm going the patient. But it is not always true.
Right.
Scale pe jao, go with the scale.
Sir Jabbar Baba is asking, law simplex going to work in the present situation or not?
Why not? It is not, nowhere it is written that one dose. It is written give what as much as required to stimulate enough the patient.
Yes.
So law of simplex is relevant that day also today. But then see, if you look at the what we call as allopathy science, they are also going minimalistic. They are also being minimalistic. They are also going judicial. They are also giving the required dosage only. It is
Yes.
already started happening in the West. Now it is already happening in India.
Right.
If you follow Indian Association of Pediatrics,
Right.
the newer guideline clearly says that give antibiotics only when it is proven bacterial fever, which
Yes.
most of the pediatricians are now following. They are giving only symptomatic treatment,
Yes. Yes.
pyretic or anti-allergic.
Right.
So they are also following the rule of simplex.
Right.
Relevant. Anyways, it is relevant.
That's true. That's true. In her, okay, subtitle I've already told. Dr. Shubhra Shankar Sinha, from which book do go through to know about the practical applicability of therapeutic pocketbook?
Best is start using therapeutic pocketbook. But then if you want to really start working on therapeutic pocketbook and you have no experience, there's a book by Dr. Bhanu Desai.
Bhanu Desai.
So it's a book of working out cases through Boger Bodingason's approach. So in that book, he nearly gives 25 cases. I've learned from the same book, so I'm telling you. 25 cases nearly gives, and he also gives cases to be worked for. And at the back side of the book, he gives the answer keys. So start doing it. Also, ICRK symposium volumes or Dhawale ke book में lot of Bodingason's cases are given. Work out the cases. And what we did is we actually rework the cases by Boger or Bodingason. And what could have been approached? What we'll do, we'll take a case, hide the remedy given by them, and then we would work the case on ourselves.
Right.
And then we'll find out the remedy, then we'll match the remedy, which remedy he gave, which remedy we gave. So what can be going in the brain? So that's how we started to decode Bodingason's of his brain. But the easiest book would be Dr. Bhanu Desai. Very simple book. He has a very good homeopathy in again 60s or 70s in Mumbai. An extensive work on Bodingason.
Rana Janvi is asking any medicine for arteriosclerosis where cardiologists advise for PTCA.
Would be very difficult question. Again, history would be very important in
Yes.
the patient because we cannot give suggestions like this. But a small reference I must make of a remedy called Sumbul. Okay, if you can open Sumbul and read from Boric. Okay, so this literature also exists in our material.
Yes.
I nowhere say that give Sumbul this patient, but I want to just make you aware of this kind of literature.
Yes.
Read Sumbul if you have Boric.
Yes, I have.
But Sumbul has his own characteristic way to prescribe, but nicely written. Sumbul is a hysterical remedy, by the way.
Has many hysterical and nervous symptoms and is of use in neuralgic affections and anomalous functional cardiac disorders, numbness on becoming the cold, numbness on left side, insomnia of delirium tremens, 15 drops of tinctures as given in the bracket, sensation as if the water dropped down the spine, asthma, a tissue remedy for sclerosed arteries. It is directly given.
Nicely simple.
How wonderful this Borike was, right?
Exactly. Exactly.
No, I'm in love with this person. How he has written each and everything at that moment of time when the things were not that proved. He doesn't had that equipments with him. उस समय इतना ज्यादा फ्लैरिश नहीं था. अभी तो बहुत कुछ है हमारे पास. आपने बोला वो वॉच में ईसीजी आ जाता है. तो अभी के टाइम पे अगर बोरिके होते तो क्या करते? मतलब ये लेवल पे थिंकिंग रखना.
The name of Boric का पूरा नाम ही देखो ना, comprising of the characteristic and guiding symptom of all remedies.
राइट.
Clinical, but then the whole it's an integration of various empirical methods also, clinical also, provings also. So it's a kind of a cocktail book.
राइट.
There's everything. Yes, use the grandma remedies also. Some articles also from other sources.
एंड कभी कभी वो बड़ी रेमेडीज के बीच में बहुत रेमेडी रिलेशनशिप में एक छोटे छोटे इंडिकेशन में छोटी छोटी रेमेडी दी होती है. व्हेन यू रीड इट यू कहाँ से आई, कैसे आई, बट
Yes.
दैट वर्क समटाइम्स वंडरफुली. तो ही इज द पर्सनालिटी जिन्होंने कुछ अलग ही लेवल पे होम्योपैथिक को देख के और उसको इंटीग्रेट किया और उसको frankly speaking looked as an allopath and treated like a homeopath and then documented it like that we can like correlate with the pathological words. Now that would be more difficult. अगर वो pathological words नहीं होते तो वो समझ में नहीं आता ना कि ये sclerosed arteries के लिए हमें ये
Exactly.
medicine use करनी है.
Exactly.
That is very true.
But then again, we do not have something like data of Sumbul and sclerosis.
Right.
Like a series too.
Yes. We don't have the larger like.
Again, Sumbul has lot of constitutional symptoms. In
Right.
fact, Moningasan की बात करें, the analog of Sumbul is a remedy called Moschus. Okay, now Moschus is a remedy which was proven during Hahnemann times. It is mentioned in therapeutic pocketbook.
Right.
And nearly 4 to 5 times it happened that while working on the case, I get Moschus as a remedy, top remedy. And I wonder how Moschus can be given. And how therapeutic pocketbook, how Bonigason gives this remedy. But then I shut my brain and okay, now Bonigason has told means something is there. And
Right.
many three cases, very nice cases treated with Moschus. Just it came up in the repertoire totality. Therapeutic pocketbook, the remedy like Moschus. Okay, smart users of the symptom.
They were so smart and they executed it very smartly.
So the repertory, the construction of the repertory is very smart.
Right.
Bonigason particularly.
Very true. Very true.
It gives every remedy an equal opportunity to come up. Well, that is what grand generalization is, which something that sometimes get missed out in Kantian approach.
Right.
Bonigason में छोटे रेमेडी को भी उतना ही स्कोप है जितना सल्फर को.
Right. That's very interesting. सर आज आपसे बात करके मुझे बहुत कुछ नए अप्रोचेस समझ में आए. वी आर गेटिंग आउट ऑफ द टाइम बट बहुत कुछ नए अप्रोचेस डॉक्यूमेंटेशन के बारे में मेरे दिमाग में एक अच्छा आइडिया भी आया है कि वी शुड डू दैट एंड कुछ टाइम निकाल के हमें वो भी करना चाहिए. इजीएस्ट मेथड्स भी हम यूज कर सकते हैं, एज यू सेड कि एक प्रोटोकॉल बना लो कि ये प्रोग्नोसिस में एक्सपेक्टेड है, उसमें क्या क्या रिजल्ट्स मिल रहे हैं, देन यू विल बी मोर श्योर अबाउट इट. ठीक है,
Yeah.
इन्वेस्टिगेशंस एंड ऑल दैट हम करवाते हैं, लेकिन दिस इज ऑल्सो पार्ट ऑफ डॉक्यूमेंटेशन. काफी पैथोलॉजिकल केसेस का एक ओवरव्यू मिला कि डोंट गेट हाइपर एक्साइटेड विद द केसेस एंड वो प्रोमिसेस करना एंड ऑल दैट इज नॉट प्रैक्टिकल. You should be more approachable to the case and do what you can do in a case. वो ओवर एक्सपेक्टेशन कभी कभी पेशेंट के लिए और डॉक्टर के लिए, दोनों के लिए हानिकारक होती है.
Yeah.
तो वो बहुत जरूरी है समझने के लिए, अभी के जनरेशन के डॉक्टर्स के लिए. और कभी कभी चीजों को इतना हाइपर ले जाना कि एवरीथिंग आई कैन ओनली डू और आई ओनली होम्योपैथी कैन डू, दिस इज अ मिथ. एंड वी शुड अंडरस्टैंड अवर लिमिटेशंस एज वेल. सो देन एंड देन ओनली वो हम एक रियलिटी बेस पे काम करेंगे और हम उसको ज्यादा फ्लरिश कर पाएंगे. सो थैंक यू फॉर हैविंग अ वेरी गुड डिस्कशन टुडे सर. एट द एंड I would like to hear something for the students or upcoming homeopaths. Any advice for them from your side?
Advice I would always like to copy from uh, Dr. Manchanda from the CC. One thing I was touched by that. Every clinical table, a doctor's table has some research to do. Take a case of common cold and research on it. Collect some 30 cases, see what you can do.
Yes.
If you're a senior homeopath, gradually we see that you now collect cases of cancer, so collect cases of rheumatoid arthritis. Do small things, one thing at a time.
Right.
Not know where the tree will grow.
Right. That's very true. So one more question is there. If you allow, can I take that? Okay. Uh, Somebody has mentioned Khadar Basha. Namaste, sir. And madam, please made a video on LM potency. So we'll definitely consider this topic and we'll try to find some better like person who can talk about it. And we are going to do a potency video next series. So do join that also. Hasnan Inamdar, sir, what is the cause of burning in the soul in diabetes and homeopathic medicine for it? Can you suggest?
Correct. Repeat the question.
Cause of burning in the soul in diabetes, like might be he's talking about diabetic neuropathy.
Most of
And
diabetes
then,
because sugar levels in the blood, they are in form of crystals. Very simple explanation. See,
right,
what it can do to the kidney, what it can do to the arteries, it can do to the nerve.
nerves.
Because our capillaries or arteries can hold a certain level of that crystals of sugar.
Right,
But if they exceed after chronic injuries, they start getting damaged. Every tissue get damaged. So the peripheral nerves will get damaged.
right,
Because the arteries will also be having because of crystals, there will be damage to the end arteries. The blood supply will be hampered and this causes burning. It's called paresthesia.
sir, any homeopathic medicines for it? He's asking for the
I
homeopathic medicine.
cannot tell in that way that which medicine for this and but then one medicine which I have got result is curare.
Curare. Okay.
Very interesting remedy. And
Yes.
read Boric again, Boric system. He
Yes.
mentions like neuropathies in lines of diabetes.
Okay. Thank you so much, sir, for coming on the stage. And at last, I want to hear how is his experience with me on my channel?
So I would say it's a very nice initiative. And people like me who are very much social media shy, and lot of good things are happening in small pockets. So
Right.
people like you can bring them and make them speak.
Yes.
And see, everyone wants to share.
Yes.
Everyone would be ready to contribute. But then there will be some game changers, some people have the skill set of integrating people mass together. So you are kind of that person, I think. So there's a good initiative, and now the reach is huge. It's a global reach now because we are live on YouTube and people will be watching these videos later on.
Yes.
More
Sir,
and
recently I've got a message from Israel also. And I'm so happy that people are watching from Israel also my channel. I don't know how it. I had a viewers from Pakistan, from the Bangladesh, because they are practicing homeopathy and definitely they would see my channel. They are getting good content out of it because different prospect and approaches and speakers are coming onto my channel. But then I got a message from Israel and I was so overwhelmed by it. So thanks to you, that was your topic that attracted that person, and he messaged me last week कि when it is happening, and please try to speak in English also, because till now I was doing in Hindi more, but that was the triggering factor. Now I should do in English as well, so that we can go globally rather than
Wonderful.
limiting ourselves to only India, Pakistan, and Bangladesh.
Kudos to you.
Yes. Thank you so much, sir. And hopefully, we'll come back with some interesting topic like documentation and all very soon. And for the viewers, keep notifying my channel. Definitely, we are going with a very senior doctor in Ahmedabad, and he will be talking about potencies and how to use it in postology, which is the most demanded topic till now on my channel. I do a topic for postology and all that. So we'll definitely bring a very senior homeopath in the coming days. And then in the May also, we are coming with a very senior homeopaths from Ahmedabad, Gujarat, and many others are coming. So there's a line of doctors on my list, but for that I need a subscriber, a good views from you. Please share this video with others who are in a need to treat the pathological cases in their lady clinic, so that we can have a good approach, good reach to the persons. एंड जो मेरा एक वो टारगेट था ना कि होम्योपैथी का एक अवेयरनेस लोगों में आना चाहिए, एक बडिंग होम्योपैथ को भी कॉन्फिडेंस मिलना चाहिए, वो तभी पॉसिबल है जब आप वो रीच पहुंचाएंगे, तो वो करिए. एंड होपफुली ऑल आर गुड एंड वेल, एंड सिया विल मीट सून ऑन आवर चैनल. एंड सर को तो मैं वैसे भी मिलती रहूंगी फिर. थैंक यू सो मच सर, हैव अ नाइस डे. थैंक यू, गुड नाइट.